The heart of the matter. What is cardiology? Cardiology is the study of the heart. This includes its structure, function, and diseases. Cardiologists are doctors who specialize in this field. They diagnose and treat a wide range of heart conditions. Cardiology is a vital medical specialty because heart disease is a leading cause of death worldwide. The heart is a vital organ that pumps blood throughout the body. The blood carries oxygen and nutrients to the body's tissues. The heart also helps to remove waste products. When the heart is not working properly, it can have serious consequences for your health. Cardiologists play a vital role in keeping people healthy. They work to prevent, diagnose, and treat heart disease. They use a variety of tools and techniques to do this. Cardiology is a constantly evolving field. New discoveries and treatments are being developed all the time. This commitment to advancement ensures that patients receive the best possible care. Through research, innovation, and compassionate care, cardiology strives to keep hearts beating strong and healthy. Ancient rhythms, modern marvels, a journey through cardiology's past. The history of cardiology is a fascinating journey spanning thousands of years. Ancient civilizations had a basic understanding of the heart. The Egyptians, for example, believed that the heart was the center of intelligence and emotion. The ancient Greeks were among the first to study the heart in a systematic way. The physician Galen, in the 2nd century AD, made significant contributions to our understanding of the circulatory system. However, progress in cardiology was slow for many centuries. It wasn't until the Renaissance that interest in anatomy and physiology was revived. In the 17th century, William Harvey, an English physician, made a groundbreaking discovery. He described the circulation of blood and the heart's role as a pump. This discovery revolutionized our understanding of the cardiovascular system. It laid the foundation for modern cardiology. A global burden: heart disease and its impact. Cardiovascular diseases, including heart attacks, stroke, and heart failure, are the leading cause of death worldwide. According to the World Health Organization, these diseases claim an estimated 17.9 million lives each year. This accounts for 31% of all global deaths. The burden of heart disease is felt across the globe, affecting people of all ages, backgrounds, and income levels. While risk factors like an unhealthy diet, lack of physical activity, and tobacco use contribute to the development of heart disease, genetic predisposition also plays a role. The impact of cardiovascular diseases extends beyond individual health. It has significant social and economic implications. The loss of productivity, healthcare costs, and the burden on families and communities are substantial. Addressing this global health challenge requires a multi-pronged approach. This includes raising awareness about risk factors, promoting healthy lifestyles, and improving access to quality healthcare. Unveiling the heart's secrets. Modern diagnostic tools in cardiology has witnessed remarkable advancements in diagnostic techniques, enabling physicians to accurately assess heart health. Electrocardiography, or ECG, is a cornerstone of cardiac assessment. It records the heart's electrical activity, revealing abnormalities in heart rhythm and detecting heart attacks. Echocardiography, commonly known as an echo, utilizes ultrasound waves to create detailed images of the heart's structure and function. This non-invasive technique helps evaluate heart valve function, assess blood flow, and identify structural abnormalities. Other imaging modalities, such as magnetic resonance imaging and computed tomography scans, provide comprehensive views of the heart and surrounding structures. Cardiac MRI offers exceptional detail, allowing visualization of heart muscle, valves, and blood vessels. CT scans are particularly useful for assessing coronary artery disease and detecting calcium buildup in the arteries. These advanced diagnostic tools, along with blood tests and other assessments, provide cardiologists with a comprehensive understanding of their patients' heart health, enabling them to make accurate diagnoses and develop personalized treatment plans. Section 5. Healing the heart. Treatments for cardiovascular diseases. The field of cardiology offers a wide range of treatment options for cardiovascular diseases, from medications to advanced surgical procedures. Medications play a crucial role in managing heart conditions, Drugs such as statins help lower cholesterol levels, reducing the risk of heart attacks and strokes. Antihypertensive medications control blood pressure, alleviating strain on the heart and blood vessels. Interventional cardiology has revolutionized the treatment of heart disease. This minimally invasive approach uses catheters to access the heart and blood vessels. Angioplasty, a common interventional procedure, opens blocked arteries with a balloon and often involves placing a stent to keep the artery open. In cases of severe heart valve disease or heart failure, surgery may be necessary. Valve repair or replacement surgery can restore normal blood flow through the heart. Heart transplants are life-saving procedures for patients with end-stage heart failure. Cardiology's commitment to research and innovation continually expands treatment options, offering hope and improved outcomes for patients with heart disease. Section 6. Prevention is key. A stitch in time saves 9. While cardiology has made significant strides in treating cardiovascular diseases, preventing these conditions in the first place remains paramount. Preventive cardiology focuses on reducing risk factors and promoting heart-healthy habits. Lifestyle modifications are the cornerstone of prevention. Adopting a balanced diet rich in fruits, vegetables, and whole grains, while limiting saturated and trans fats, is essential for heart health. Engaging in regular physical activity, at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week, strengthens the heart and improves cardiovascular fitness. Quitting smoking is crucial, as tobacco use is a major risk factor for heart disease. Managing stress through relaxation techniques such as yoga or meditation can also benefit heart health. Regular checkups with a healthcare provider are essential for monitoring blood pressure, cholesterol levels, and other risk factors. By embracing preventive measures, individuals can significantly reduce their risk of developing cardiovascular diseases and enjoy a longer, healthier life. Section 7. The future of cardiology. Technological advancements. Cardiology stands at the cusp of a technological revolution, with emerging innovations poised to transform the field. Artificial intelligence, or AI, is rapidly being integrated into cardiology, from improving diagnostic accuracy to personalizing treatment plans. AI algorithms can analyze vast amounts of data, such as medical images and patient records, to identify patterns and predict cardiovascular events with greater precision. Wearable devices, such as smartwatches and fitness trackers, are empowering individuals to monitor their heart health in real time. These devices can track heart rate, detect irregular rhythms, and even provide notifications of potential heart issues. Nanotechnology holds immense promise in cardiology. Researchers are developing nanoparticles that can deliver drugs directly to diseased heart tissue, improving treatment efficacy and minimizing side effects. Stem cell therapy is another area of active research, with the potential to regenerate damaged heart muscle and restore heart function after a heart attack. These technological advancements are revolutionizing the way cardiovascular diseases are diagnosed, treated, and managed, paving the way for a future of precision cardiology. Section 8. A heart-healthy future, embracing a new era of cardiac care. As we move forward, cardiology will continue to evolve, driven by a relentless pursuit of innovation and a commitment to improving patient outcomes. The integration of technology, personalized medicine, and a focus on prevention will shape the future of cardiac care. Telecardiology, which allows for remote monitoring and consultations, will improve access to specialized care, particularly in underserved areas. Gene editing technologies hold the potential to correct genetic defects that contribute to heart disease, offering hope for preventing these conditions at their root cause. The future of cardiology is bright, with advancements promising to extend lifespans and improve the quality of life for millions worldwide. By embracing a holistic approach that encompasses prevention, cutting-edge treatments, and ongoing research, we can strive for a world where heart disease is no longer a leading cause of suffering and loss.